So we have already 20 people on board. Again, a warm welcome to this important session of today. We are very happy to have you on board because especially for Europe and African countries, it's a very early morning for the session. But I think for the participants from Asia, it's a fantastic time. Welcome, a fantastic hour. Welcome to all of you. Again, as I mentioned before, introduce yourself in the chat. And also please inspire us with any thoughts you might have on the meaning of GESI. And this you can do in the poll, which you can find in the pathable environment. I think we have already 21 guests. I'm just looking at Brechtje. Just give me the sign when I can start a session. Maybe we are waiting still for some more guests to arrive to the session.
I think you can start, Marco.
Yes, we can start. Okay. Okay, so again, thank you so much for being here with us. Before I will proceed with the agenda, allow me to introduce myself. My name is Marco Bolwerk, and I'm a part of the WASH SDG program from Plan International Netherlands since the very beginning. As you might have seen in the introduction session for today, this session was actually to be facilitated by Tracy Keatman, but unfortunately she could not make it this morning. So that is why I will be doing this job today. So please bear with us, and still thank you so much, Tracy, for your fantastic preparation work. Yeah, I think, Brechtje, we can go to the introduction. Maybe before we start, did anybody fill out the poll?
I will.
Because if so, then we could show something. And again, I see now 30 people. Please introduce yourself in the pathable chat. And I think, yeah.
We don't have any answers yet, but feel free to continue filling this in during this session when you get inspiration.
Oh yeah, that would be really great. Okay, so yeah, I think we can start with the agenda. So let me see. So today we are very honored to have 3 guest speakers from Bangladesh, Uganda and Indonesia. But before we go to these key speakers, allow me to introduce the agenda. So first, I will do a little introduction of the WASH SDG program and the role of GESI within it. And then I will discuss with Sylvia Divina, who is Early Childhood Advisor and WASH Advisor for Yayasan Plan Indonesia. Then I will discuss with Hanifa Kasula from Semavi, Uganda. And thirdly, Marilyn Keka, I believe you are called especially Keka, Atikari from SNV Bangladesh will also share experiences on GESI through program implementation. And then we will end the presentations, which also will be accompanied by videos, very illustrative videos. We will end all the separate presentation by a panel discussion. So I think this is a bit how the program looks like, and I'm very much looking forward to, because the reason we are today here is because we have been learning a lot throughout the WASH SDG program in the past few years on GESI implementation and also GESI during COVID-19. Yes, so please, the next slide, Brechtje. So what we can see is that explaining about the WASH SDG program, it responds actually to the Dutch commitment to contribute to the sustainability development goals, and that is in particularly SDG 6, with the aim to reach an improved WASH situation for all. So this program is implemented by the so-called WASH SDG consortium, consisting of 3 partners, being the WASH Alliance International, also consisting of different parties, amongst others Semavi and UNRWA. In the second place, SNV as a main partner of the consortium, and Plan International. And the WASH SDG program is implemented in 7 countries, as you can see, being in Bangladesh, Ethiopia, Indonesia, Nepal, Tanzania, Uganda, and Zambia. And in each country we work together, we have 2 or more subnational or so-called sub-programs per country. So as you can see, we are aiming to reaching safe drinking water for at least almost 500,000 people, sanitation for at least 2 million people, and improve the hygiene behavior for more than 1.5 million of people before the end of 2020. So the program is built around 3 core objectives. First is increasing demand for improved wash facilities and practices, improving the quality of and existence of wash service provision, and also governance of wash sector strengthening is a key strategy. However, this program is not only about achieving more access, but it is really also about improving gender and social inclusion. These are actually areas of key attention throughout all these strategic objectives. And actually the implementation started in 2018, and the program will take place until the end of next year. So I think we can go to the next slide, Brechtje. Also, welcome again to all the new participants. I see we now have more than 40 people on board. So I just explained about the key strategic objectives. So gender equality and social inclusion, how does that look like within the WASH SDG program? Actually, the activities related to gender and social inclusion are conducted on a national, city, village, and community level. And all the programs, all the sub-programs work together with public, private, and civil society partners. Thirdly, national and global learning and knowledge development on GEC has been promoted through a dedicated community of practice. This community of practice started from the very first and really enabled all the parties, all the staff of all the programs to really gain more experience. And that leads to the 4th bullet point. Through the program, we really have contributed to strengthening the staff and the partners' capacity when it comes to GEC. So actually what I want to say is GEC is really cross-cutting across all the 3 strategies. So this was mainly to give you an idea how GEC is anchored throughout the program. And Brechtje, we now can go to the next slide. And then we are now getting into the focus of today. And that is really GEC in the COVID-19 response. So as we all know, the world really changed around March 2020 when COVID started entering our lives and our works. And from the very beginning, we noticed that COVID-19 affected much more on those people with little or no access to WASH services and information. And also the pandemic highlighted that it was really, how access to WASH practices are more critical than ever. At the same time, also we found that this current pandemic also offered opportunities to empower and build the resilience of communities. And within these, how these opportunities can ensure inclusion of women and socially excluded groups. So while the most vulnerable in general or in theory are likely to be much more affected due to the poor access to WASH, it is possible to reduce inequalities through the use of a gender and socially inclusive WASH COVID-19 response. Also, we have seen that communication and behavior change interventions have an important role to play, as well as alignment and collaboration with local authorities and other key stakeholders. So finally, not only a GEC lens can be applied or should be applied during a pandemic like the current one, but also it should be taken into account when developing mitigation and adaptation plans for the future. And to that, we will come back also during the panel discussion. So this was a little bit to introduce from my side and to provide you a global picture on how COVID-19 and WASH SDG program looks like. And now I'm very happy and actually also very proud to have with me on board Silvia Devina, who will present and introduce a little bit the Winner Project, which is the Indonesian name for the WASH SDG sub-program in Indonesia. I give the floor to you, Silvia, so you can explain a little bit how the program looked like.
Okay, thank you, Marvel. Hello, everyone. I hope you're well. Please introduce myself. I'm Silvia Devina. I'm currently working as a WASH and ECD advisor at Plan Indonesia. Today I'll be presenting about how we also work together with women and people with disability, intervene on all our WASH project in Indonesia. So our WASH project is called Women and Disability Inclusive Nutrition Sensitive WASH Project in Indonesia, and we call it Winner Project. Okay, can you please go to the PowerPoint slide? Yes. Okay. Yeah. Next, please. Yeah. Okay. The previous one, the map. Yes, okay. So this is a map of Indonesia. This is where we work. We work in 2 different provinces, East Nusa Tenggara and West Nusa Tenggara. As you can see, we work in 1 city, Mataram City, and 3 different districts, Central Lombok, Belu, and Malacca. We work together in partnership with the government. We work in the village level, in the district level, sub-district, and also in schools, because we also train peer educators. We work in special needs school, elementary schools, and junior high school. Next, please. Okay, as I mentioned earlier, we work in partnership with women and people with disability organization. So they become the subject of our project. So they drive this project forward. As you can see, one of the example, we work at the national level, is we develop a policy brief to mainstream gender equality and social inclusion into the STBM, or all the WASH activities. So this policy brief is already accommodated by the Ministry of Health, and this will be the basis of the revision of the regulation. So it will mainstream all the gender equality and social inclusion into all the WASH activities at the national down to the village level. So next, please. I'm just gonna walk through all of these slides, but mainly before we start the video, I think I'm gonna probably share my screen. Okay. I need to go to the next slide of the PowerPoint presentation, but before the video. So I think I'm gonna just share my screen if that's okay. Can you all see the screen? Yeah, so I'm gonna go through this slide actually before we go to the video. How we done Jessie STBM. So this is it. We work in 3 different components: enabling environment, demand, and supply. So at the enabling environment, we work together with the government to make sure that all the regulation and all the personnel has been trained on what is Jessie, so they understand why it is important to implement Jessie in all their regulation. At the demand side, we stimulate the demands at the community. So the community, including the people and people with disability, they understand that it is also their basic rights to access water and sanitation. And also we increase the demand of all the WASH facilities. At the supply side, we train all of our WASH entrepreneurs, including people with disability, so they can provide affordable hand washing facilities, toilets, and including transparent face masks. So as you know, before we start the video, one of our intervention is to train the people with disability to make transparent masks. This is important because the conventional mask may not be able for the deaf people to see the lip movement of other people. So that is why it is important that the people with disability, they make this mask. So it is used for the deaf people, also for non-deaf people. So it can be used for everyone.
Yeah. Thank you so much, Sylvia, for your fantastic presentation. And I think also we will have this fantastic policy.
Now?
Yeah, we will have this fantastic policy brief available for all the participants, so they can learn more on this great HC achievement during the WASH SDG program implementation. And I think now, we would really like to hear from you how you have been doing HC through the when COVID-19 entered into our lives and also in your programs. And I think also for the sake of time, indeed, we will just start a video which is fantastically illustrative for how you have done that. So please, Brechtje, start with the video. Thank you.
Yayasan Plan Internasional Indonesia melalui Winner Project saat ini sedang melaksanakan kampanye pencegahan COVID-19 melalui intervensi WOS yang inklusif. Melalui pendekatan yang inklusif, kami berharap program ini bisa bermanfaat untuk semua orang, termasuk kelompok penyandang disabilitas. Salah satu kegiatan yang kami lakukan di masa pandemi ini adalah dengan mengembangkan masker transparan untuk kelompok tunarungu. Pengembangan masker transparan ini dilaksanakan secara kolaboratif antara Plan Indonesia, organisasi disabilitas, dan wirausaha sanitasi.
Lidi Foundation telah bekerja sama dengan Plan Indonesia dalam mengembangkan masker transparan melalui pelatihan yang difasilitasi oleh Plan Indonesia dengan melibatkan penjahit dan kelompok tunarungu. Karena dengan masker konvensional, teman-teman tunarungu tidak bisa membaca gerak bibir lawan bicaranya.
Saya senang sekali mendapatkan pelatihan dari Plan Indonesia dan Lidi Foundation tentang masker transparan. Saya sangat tertarik karena ini inovasi baru untuk membantu tunarungu dan masyarakat luas untuk tetap bisa berkomunikasi dengan baik di situasi pandemi.
Masker transparan tidak hanya untuk tunarungu tetapi juga untuk non-disabilitas. Terima kasih untuk Plan dan Lidi Foundation yang sudah membantu membuat masker transparan untuk kami.
Wow, what an impressive video we just saw, which really illustrates the achievements of how Plan Indonesia, the sub-program, went about HACI approaches and adapted these throughout the COVID-19 pandemic. Thank you so much, Sylvia, and not only to you, but really, yeah, to all of the Yayasan Plan International Indonesia team. You have been working on this for many, very hard in the past few years. And also for the audience, if you have any comments or questions, suggestions, whatever, please put them in the chat box of the pathable environment. So we will be able to come back to them later, because as I mentioned before, after the key speakers and videos, we will have a panel so we can address all your comments or questions for clarification. So I will now move to Uganda and welcome again Hanifa Kasule. How are you doing today?
Hi, Margot.
Hi, really nice to see you, to have you on board. So we are now going from Indonesia to Uganda, and my main question to you, can you explain a bit to me and especially to the audience, what kind of HACI approaches and activities have you been working on prior to the pandemic?
Thank you, Margot. for the question. I'm happy to be here. Allow me to reintroduce myself. I'm Hanifa Kasure, and I work as a Program and Communication Support Officer on the WASH's DG program in Uganda under Simavi. Now, to respond to your question, before the onset of the pandemic, and indeed since the start of the implementation, the program has been integrating JESI as one of the cross-cutting themes across the 3 strategic objectives, that is behavior change, service provision, and WASH governance, like you earlier mentioned. For instance, under behavior change, the program was implementing gender action planning at household level. We were doing MHM in schools, as well as using role model men in communities. An example under service provision, we created a safe space for female entrepreneurs to share and exchange experiences and knowledge. And under WASH governance, the program works with women, community-based organizations, and promotes participation of the women and other marginalized groups in community dialogues, in addition to ensuring that these same groups get the opportunity to hold key positions on water management structures where they can influence decision-making. Thank you, Margot.
Yeah, that sounds really great. An amazing job you did as well, working on HACI and Uganda. And tell me, can you also explain a little bit more what happened when COVID-19 entered into your lives, into your work, and especially into the sub-program of the WASH SDG program? And what way did you adapt your work on HACI in order to respond to the COVID-19 response?
Thank you again, Margot, for that question. The advent of COVID, with all the restrictions came with, like lockdowns and closure of schools, made it necessary for the WASH SDG program in Uganda to re-strategize on how to continue reaching marginalized groups and continuing to ensure that no one is left behind. For instance, the program has boosted its use of digital platforms like radio and mobile phones. We have increased our use of radio talk shows, radio jingles, and sport messages to continue advocating for JESI. We have developed a mobile application that has been designed for entrepreneurs to continue engaging. Another way that the program has adapted to the COVID-19 situation to continue with JESI integration is by working with already existing community structures like women groups. We are also working with religious leaders, school teachers, and village savings groups. We realized that we can use these structures to continue reaching and engaging the school children that are currently locked at home. As you'll see in an example in the video that will be showed is of how we are working with teachers to continue reaching the children. And lastly, the program is working with the district COVID-19 task force. We work in only one district in the country. So we are working with the COVID-19 task force of the district to ensure that the JESI component is integrated in their COVID-19 response agenda. Thank you, Margot.
Yeah, thank you so much, Hanifa, for explaining all the great work you have been doing, making HACI work in COVID-19 times. And as you just mentioned before, I think now we will proceed to showing the video that also shows the response taken by your school in Agago, where you're working to developing strategies to ensure ongoing access to MHH and SRHR services by the learners. So thank you so much, Brechtje.
My name is Madame Flores Mukasa from Uganda. I am the head teacher of Ajalanyana Primary School, which is located in Agago district in northern part of Uganda. There is information gaps between we the teachers and the learners. The guidance that teachers are used to give the learners are not there because they are at home. Having got the training from WASH Alliance, we came back to school. We developed work plan, school work plan to help to direct us in the implementation of the project. 2, we train all the teachers on how to make the sanitary facilities that would support the girls in the management of menstrual hygiene. We also create awareness to the school management committees and to the PTA on how well or how best they can convince or talk to the communities so that they would be in the position to support their learners, especially the girl child, in handling menstrual hygiene management and sexual reproductive health rights. Knowing very well that currently there is no public gathering, the only way that people or the community around can access information is through media. That is what I recommend. 2, the parents, as one of the stakeholders, have to give support to their girls, even the boys, so that they be in the position to know how best they can protect themselves or manage menstrual hygiene management and sexual reproductive health rights. Another strategies that I have done as the head teacher is creating close relationship with the learners. To the extent that during the lockdown, some of the girls were coming to me for consultation, and I was giving them guidance, mentorship, advice as well on how best they can manage their situations. The district also at the same time to carry out constant sensitization of the people through radio talk show, because they have the community, they have the opportunity in doing that. As the district also, they have to integrate the program of menstrual hygiene management and sexual reproductive health rights into their work plan. Even the religious leaders, wherever they are on radio talk show, they have to continue advocating for girls and for proper management of their menstrual hygiene management and sexual reproductive health rights, because it's one of the key aspects that is making our girls to drop out of schools if they are not well supported.
Okay, well, thank you so much, Anifa, for this fantastic video, showing the experience you have been obtaining during the COVID time. That is really incredible. And again, I would love to ask some questions on it, and I guess also the audience, but please also for the participants, share all your comments and questions you might have in the chat box from Pathable, so we will come back to it later, that is after the last contribution from one of our key participants, which is Marilyn Keka Atikari. I would say Keka, I believe that is the way you are being addressed always. So also a very warm welcome to the session. You are working for in SNV Bangladesh. And over to you. After Indonesia, Uganda, we are going to Bangladesh. So my question to you is, what kinds of WASH capacity building and knowledge sharing activities did SNV conduct prior to the pandemic?
Thank you, Margaret. And good afternoon from Bangladesh. And as you asked me the question, I can reply in that way that prior to the pandemic, SNV actually conducted several activities on capacity building and knowledge sharing. And among them, I can mention about several global events that was organized between SNV countries on different topics. And in Bangladesh, along with FSM Network Bangladesh, we organized 4 FSM convention for sanitation workers, especially the MTR's convention. We also, organize several trainings, many trainings actually, on different issues, different topics like occupational health and safety, BCC, communication, technology, options, and many things. And we also organized, that is exposure visits. We conducted many studies, and we organized a national level knowledge and information sharing program. And we also published several documents, especially different training modules. We installed billboards with messages and videos. And like this, we actually worked in that area.
Yeah, and can you just share an example of what kind of participants benefited from these activities?
Actually, when we organized this capacity building and knowledge sharing program, most of the time our participants are from national level and city level government official, and we also get in our program often we get the participation from city mayors and the councillors and that other NGOs, community-based organization participants, and we also have participants, from school, college, the educational sectors, and sometimes even housewives are also the participants of our program. And they actually learn many things about, especially about fecal sludge management. How they can manage their toilet, and the whole more nice and safely managed. So when they learn the things and learn the information, so especially the officials, when they make the plans, especially the mayor and the councillors make the plan for their cities, obviously this type of knowledge help them to develop their policy guidelines, and what is actually relate to the the country development plan, and also actually what I can say that is they can learn about the country existing policy and rules and regulation and laws. So
yeah. Thank you so much, Keke. Really good that you are providing all these examples. And of course, also for you the question, what happened when COVID-19 entered into Bangladesh, and how did you use all the skills that were obtained by all the people you worked with before? What happened? How could you how did people benefit from all these skills during the COVID-19 response?
Yeah. That is suddenly the whole world faced that pandemic situation, and most of the people didn't have this type of experience before and knowledge before. So suddenly we come to know that is we have to maintain social distancing, we have to cover our face, and we have to use masks and so many things. But when we see that, we felt good and confident in that way, because we organized several trainings on occupational health and safety, and we actually trained some trainers through our TOT programs. So that is when it comes for this pandemic, the city corporations and municipalities, they organized trainings and orientation for the sanitation worker of their cities. So those trainers who were trained before, easily they could come forward and take the lead in giving the training sanitation workers with more confidence and more experience. And
that sounds really great, Keke. And I believe, in order also to further illustrate your story, we have a video which precisely is showing how the training of trainers has enabled the cascading of COVID-19. knowledge and capacity to sanitation workers in Bangladesh. So Brechtje, over to you.
Hi, I am Marilyn Keka Udhikari, working as capacity building and training advisor with SNV Bangladesh. Today I'm going to tell you a story about a trainer. As all you know, society's proper functioning rests on the backs of many essential workers, mostly low-paid workers with no option but to go to work, no matter the risk they have to take. Sanitation workers are part of this group of essential workers. To realize cleaner and healthier cities, SNV's COVID-19 responses include the capacity building and improving knowledge of the sanitation workers on occupational health and safety measures during this COVID time. I was going to tell you the stories about the trainer, and name of the trainer is Mr. Monjurul Islam. He is a slum development officer for one of the cities where SNV works. During this recent COVID-19 pandemic, Monjur conducted several trainings for waste and sanitation workers across different cities on occupational health and safety and infection prevention and control. The MTers and other sanitation workers are mostly illiterate. They cannot read campaign leaflets, poster, or instruction about COVID-19. For that reason, actual face-to-face training were organized. For most of the participants, it was the first time ever to actually participate in a training. Monju tried to make them feel at ease, speak their language, and bridge the gap between trainer and trainees. The training was about showing them the reason behind OHS and IPC and what they need to do to improve their own health and safety. The training modules contained easy to convey information. One of the trainees is Ajoy Bishwas. He is a 34-year-old sanitation worker who attended this type of training previously. And this time it was on COVID-19 in relation to health and safety. But most importantly, he expresses how great it is that many of the sanitation workers community have been able to get this opportunity to take this training, because the work they do is often shrouded in social stigma. Protecting the health and dignity of our sanitation workers and raising COVID-19 relevant hygiene awareness among them is essential in realizing cleaner and healthier cities. Thank you very much.
Thank you so much, Keka, for this also fantastic illustration of how you went about HESI and COVID-19 times. And I think, yeah, I thank you so much again for all the key speakers for sharing your practices and showing it through your illustrative videos. And I think we now have come to the time that we can, go to some questions. I would like to, I'm very curious. I feel after all these presentations, it feels as if I'm in Indonesia, Uganda, and Bangladesh all together, although it has been so long that I and all of us have been traveling. But maybe before, I want to hear from the three panelists some main takeaways you would have from your colleague presenters, and also go to some tips and tricks. Allow me to look at the questions that came from the audience. I think we have some of the questions. I think one question is about Claire, came from Claire. I don't know to what presentation it was, but she is asking, I wonder if any of the stakeholders rely on working animals to carry water. It's a very specific question. I think it is a question related to the last presentation. Can maybe the person who have or maybe the question is already answered? I will go to the next one. I also saw another question, which was already answered, but I just want to share it with the audience. This was a question from Saisen Sima. was very curious about the users who are using the transparent face masks and if they are breathable, which already was answered by Harry as well in the chat box. So please have a look at that. So maybe if we have no questions at this very moment, I'm curious to hearing from Sylvia or either Pekka, to hearing what are your main takeaways after seeing after hearing the experiences from your colleagues in Indonesia, Bangladesh, and Uganda. Is there anybody who wants to start? Just the very first question.
Can I start?
Sure, Keka.
Yeah. So actually, it is really encouraging to be here and listen from my colleagues who are working in different countries and with different, technology and strategy. And when I have seen the presentation from my friend from Indonesia, it is really encouraging. That is, that when you want to do something for a community who are not getting all the facilities of the societies, then you can actually start with a small thing, but you have to have very keen observation that where the need is. So I think Indonesia, they really find out that a very important area, needed area, especially for the people who cannot hear properly. So that I think this type of mask is very much helpful for them. And like this, what I feel that is in every area, people who are not in a very good situation, who are struggling in their lives, we can make this type of initiative for them. And involving the other people, involving the city and the government authority with that, it can help more. And what I have learned and I like to take from the presentation from my friend Uganda, that is really that is a single person. If she wants, or if he wants, she or he can do something and can make a model what that can be demonstrated, what Uganda has done. Really,
thank you so much, Pekka. Also, for the sake of time, I would like to go to Sylvia or either Hanifa. Hanifa, I don't see you on the screen at this moment, but I know you are there. So we are very much wanting to hear your reflections. So either Hanifa or Sylvia, you can take the floor.
Yes, thank you, Keka, for the interesting comments. Yes, I agree that every activities that we want to involve women and people with disability, we have to make sure that they are the subject of all the interventions. So they are the one leading the process. So we work in partnership with them. We ask for their feedback. In terms of making the transparent mask, we make sure that they give us feedback. So it is breathable, so it is countable, and they give the feedback to the tailors. So it is important for them to be included in all different steps of the prototyping of the transparent mask. And I think the important message for transparent mask is it is important to use for both the deaf people and then the non-deaf people. So the people who are not deaf, they should understand that it is also important for them to wear it so that the deaf people can read their lips movement. So I think that's the perception in the community, because they think that people who are deaf are the only one who can use it, but actually it has to go for both. Like you see in the video, the teacher of the special needs school needs to wear it so that the student understand, and the student also needs to wear the same transparent mask.
Very, very clear, Sylvia. And maybe what are your takeaways? What did you learn from the other presenters? What struck you most?
Yeah, I think what I learned from Uganda and Bangladesh are the same challenges and barriers that we face during COVID-19. You know, we have to do everything online, and then we have to change our strategies. We have to make sure that if we want to do offline meeting, we have to do it in a safe and healthy procedures. So that's, I think, the same things that is faced by the Indonesian team as well.
Okay, so thank you so much, Sylvia. Well, I now over to Hanifa. I think maybe she has not put on her camera also due to electricity issues, but Hanifa, please, what are your thoughts on the experiences you have been listening to and watching just now?
Thank you, Margot. On my side, from all the videos we have shared, my main takeaway is that it is important, if we are to achieve sustainability in the innovations that we come up with to address challenges, that we involve the people that are concerned, like the special needs groups, in the designing of these innovations. And that way we can achieve sustainability and we get to end up with the best results. Thank you.
Yeah. Thank you so much, Hanifa. Thank you so much for your contribution. So I think I'm so curious to hearing more about the tips and the tricks from the three key speakers. But before I do so, I believe there was one question from the audience, which is actually related to that. This question is from Isabel, who is asking what has been the greatest obstacle to creating inclusive policy that really lasts? And maybe Sylvia could comment to that, just taking into account that you were involved to supporting WASH GC COVID-19 inclusive policy. So maybe I give the floor to you first.
Yes, okay. Thank you, Marco. Thank you, Isabel, for the question. I was just about to type in the answers, actually. So thanks. It's great that we have time for direct replies. But I think the main obstacle is lack of awareness of the stakeholders that these people, you know, women and people with disability are often seen as marginalized people. So sometimes they are not recognized. They are not included in the monitoring. They are not included in the basic data of basic needs in the community. So I think the greatest obstacle is lack of awareness of the stakeholders, that they do not understand that people with disability also have the same rights to water and sanitation as with other normal people, you know. So I think the first step for us is to increase their capacity. And then we work in partnership with the people with disability organization, so they will advocate their own rights to this government, to the stakeholders. So I think that is the key, to increase the awareness, but the people with disability has to do it themselves. We cannot speak on behalf of them all because they can understand their rights better than us. So I think that's the key steps, is to involve actively as partners, these people with disability, so they can voice their own rights to the government. So that's the first step, to make the government understand. And then after that, we need to make sure the advocacy is going. So like we did in Plan Indonesia, we make sure that we included policy brief to make sure the gender equality and social inclusion is included in the regulation. So I think those two steps are the key to make the policy sustainable. Yeah. I hope that answers your question, Isabel. Thank you.
Yeah. Thank you so much, Sylvia. And another question I would have for all three of you is to really learn if you could share a bit more about tips and tricks while working on GC through WASH interventions during COVID-19. But I leave you a little bit to reflect on that. I will come back to that in 1 minute. I will just take one question from the audience, which came from Saisen Sima. Sorry, not Saisen Sina, sorry, that came from Carmen. This is a question to Samavi. The question is, apologies, Carmen would love to learn more about the mobile app Samavi is using for entrepreneurs. So I'm wondering if Hanifa maybe can explain a little bit more. How did it work? How has the mobile app become a great added value for the entrepreneurs you're working with?
Thank you, Margot. The app has been designed as an interface where entrepreneurs can go. They put it on their mobile phones. They don't even have to be smartphones. Any phone can do. So it helps them to track their sales, to track the stock of materials that they have. And also they can see their colleagues, who else is dealing in what and how they are performing. So they can also get contact details of other entrepreneurs such that they can keep in touch and exchange information on the various aspects of their businesses. We have found it very useful during the COVID-19 period because there are challenges like reduced mobility. They are not able to move easily to look for the raw materials that they use in things like soap making and making of the reusable sanitary pads. But as they are engaging on this platform, they can share tips on where the materials can be got. And also they can share on who still has stock, and maybe they redirect some of the customers that come to them. If you don't have something, it is easy for you to see using the app who has what, and then you can maybe request your customers to go there if you don't have it. Okay, thank you.
I think Hanifa, you gave a quite clear explanation on how it works, so thank you for that. So now I'm still quite curious if one of the three panelists can still share some tips and tricks on how to ensure WASH response are HESI-proof, and maybe not only in COVID-19 times, but also in other potential health emergencies beyond COVID-19. I know it's a very broad question and a challenging one, but let's see, Hanifa, Kika, and Sylvia, if you have some ideas to that, or maybe even the audience.
From my experience from Bangladesh, what I like to say, that is what I found, that is if there is rules and regulations and policies and laws there, then it is very easy to actually work for these disadvantaged, underprivileged people. So I think we have to work first to bring the changes and in the laws and add the new clauses what we feel that appropriate for the underprivileged people. So I think that is first thing we have to do, that bring changes to the laws and the existing policy and regulation. I can give you example now. Many of our city have their own occupational health and safety guidelines. So when it is approved by the city authorities in the committee of the city, then everybody are bound to follow that. So in that way, we can do that. And
thank you.
We have to have the participation from this underprivileged common community, and so that they can come forward and they can say about their needs and what actually they like to have. So I think are very much important.
Thank you so much, Keka. And I believe you are also echoing a little bit the experience as commented by Sylvia, isn't it? Also about changing the policies and also including the unheard, people who are not that privileged and don't have a strong voice. Okay, so I'm looking at the other two key speakers. Do you still have any tips or tips you would like to share with the audience?
Yes, Margot, thank you. In our experience in Uganda, the tip I would share is that whenever we are addressing issues that involve women or trying to solve problems that are targeting women, it is very important to involve the men and even the boys. When we are dealing with the girls, we should involve the men and the boys as much as possible. Then also building the capacity of structures that we have already found existing on the ground is very key to ensuring that the initiatives we come up with involving JESI are sustainable and that they can be continued long after we have left, because the program time will come and it will come to an end.
Yeah, thank you, Margaret. Thank you. Yeah, thank you so much for this great contribution as well. So I'm also looking at the time. We are 5 minutes before the end of this session. And I think both Hanifa and Keka just shared some trips and tips. Maybe Sylvia could think of one last tip and trick, but before I do so, I just saw questions came in. This is a question from Ranjan, asking how we can ensure policy strategies are put into practice. I think this is a very interesting question because it really is aligning with the issues you were just sharing on the importance of having policy and involving the marginalized people in all the aspects. But maybe somebody can reply to how can we make sure policy strategies are put into practice, and that is policy practices that are really GESI inclusive, GESI proof, that is. And this will be the final question for the session of today.
I think I can add a little bit on that, Margot, how we make sure it is put into practice. I think that's a big homework for us as a project implementers. But I think one of the key steps is after we advocate on implementing the regulation, we need to make sure also to be involved in the budgeting process. So that's what we do in Plan Indonesia. We make sure that the government, the district government, provincial government, they put the budget of activities on GESI, for example, training and then monitoring, to make sure that it is included in the budget system of the government so that it will be implemented within the next year. So I think that's the key steps, the next steps that is important and lessons learned from Indonesia.
Yeah, thank you so much, Sylvia, for this explanation. And I think this really answers also to the question, I hope. So again, looking at the time, I just, if we have no other questions or main advices on tips and tricks, again, this session is not the end. We are still in this community of practice. We will be continuing to learning a lot on GESI during WASH implementation, and especially also during COVID-19 implementation and beyond. And I think looking back at main takeaway messages, we can see that COVID-19 has been terrible, yet at the same time also it allowed to strengthen capacities and opportunities to include marginalized groups and people. And I think the three key participants have been able to show how the sub-programs of the WASH SDG program have gone about that. And also I think it's really important to address governments and policymakers also for future pandemics, so that this can be taken into account, all these lessons learned. And I think for now, the only thing I can do is to really thank so much to all the presenters. I know you have been working so hard in the past few years, and today it's like the cherry on the ice that you have been able to show this to the audience that has been very eager to learning about GESI in WASH and GESI during COVID-19 times. And for me, I just want to thank to all of you. I see we still have 53 participants on board. Thank you to all the participants, and from my side, have an amazing day and keep on working and improving on making GESI happen and WASH during COVID-19 times. Thank you so much. And maybe Brecht or Marcia, if I forgot something, please allow to, you can mention it now.
No, brilliantly. Brilliant, you're perfectly on time. Thanks, everybody. Thanks, Margot, for facilitating this session. Thank you so much.
You're very welcome, and have all a very great day. And thanks again.
Thank you, Margot. Thank you, everyone.
Bye, everybody.
Sylvia. Thank you, Keka. Thank you, Anifa.